So in myeloma assessment, we have a very important tool, which is PET-CT. We can use PET-CT both at diagnosis and after therapy to evaluate the metabolic response. A huge job has been done regarding the use of functional imaging techniques in myeloma, and especially regarding PET. The main job of this last year was to try to standardize this technique to be able to propose as a standard technique to evaluate response to therapy outside the bone marrow. At the same time, we can use PET-CT at diagnosis, at baseline, to map the disease and to have a sort of picture. And we also know that it can play as a prognostic factor. I think that really nowadays is important to have functional imaging techniques in the diagnostic workup of multiple myeloma, because these functional techniques are at the same time giving a map of the disease, which is that is one of the reasons why often patients are starting treatment, but they are also prognostic factors, and they are able to identify those patients, for example, with extramedullary disease, which is quite a bad feature for the patient. And they became a tool to evaluate response. So I think that really the role of functional imaging technique is well established in myeloma, and more people are getting used to consider this.